keep hearing, when will things be back to normal, like they were before COVID? History shows, however, that events of this magnitude marked the end of one era and the beginning of the next. The past is a foreign country. They do things differently there, wrote L.P. Hartley. And tomorrow is a new day. It is untouched. Hope, optimism, and positive signs are unmistakable now. We are all doing everything possible during COVID to stay connected. Working mothers cherish newfound time with their children. We spend more time with family over home-cooked meals. We Skype with our friends. We celebrate birthdays with drive-bys and weddings on Zoom. All around us, Canadians are practicing social distancing and looking out for others. Canadians know the decisions we make as individuals have an impact on others. The need to do our part to ensure that everyone within our borders is safe is evident. Kindness and charity for the most vulnerable has taken hold more than the virus has. Governments at all levels are working together. Essential frontline service workers and health providers are putting themselves out there for us, not flinching. Many things about our new normal are refreshing. I think L.P. Hartley was right. While COVID-19 is bringing us closer together, it has brought us hardships and daunting challenges. Over 90% of our patients needing health care are homeless and impoverished, stuck now, living in crowded shelters, settlement hotels, basements, or couch surfing. They are vulnerable and they are often alone. Most are persons of color, trying to regain their footing in a new country. Being isolated and separated from their homelands and loved ones in a pandemic is proving more than difficult. Not surprisingly, they are hit the hardest by COVID. Being without established access to health care heightens their vulnerabilities. We are treating more depression on an already stressful background of trauma and PTSD from dangerous journeys. They all work off the grid, doing our dirty, dangerous jobs with little or no protection. COVID has erased many of their jobs. They don't qualify for government assistance. Our center treated our first COVID-19 patient on March the 6th, 2020, in our parking lot. We knew more would soon follow. Within 3 days, we had treated and sent 5 more to emergency rooms. Sadly, all were turned away without treatment or advice, sent back into the community in the midst of a pandemic. They couldn't pay the $800. We found new ways to treat them, virtually. We kept them at home, monitored them, provided advice and help. Our team was in disbelief. How was this in any way prudent for anyone? We advocated to all levels of government. Our message to the Premier, health ministers, Mayor, Mr. Trudeau was simple. When we fail to provide care to everyone in our communities, we provide care to no one. The province of Ontario responded. Within a few weeks, the Premier announced that all uninsured new to Canada and returning Canadians would receive health care at no fee during the COVID-19 pandemic. It is an extraordinarily positive health equity moment in Canada. It has never happened before, and we hope it is never reversed. Soon, COVID was harming those without the virus. Hospitals stopped all but the most urgent surgeries. Community family doctors' offices closed, and most still are. Patients with lacerations, chest pains, depression, chronic diseases began avoiding doctors' offices and emergency rooms. Many could not find care. Our team set to work. We started reaching out, checking in on the 3,800 refugees, migrant workers, and undocumented in our communities that we have provided health care for over the past 2 years. We have reached 700 of them by now. We needed to go faster. Using donated funds, we set up a virtual triage and treatment team. Nurses, receptionists, nurse practitioners, physicians, mental health workers, dietitians treated most patients without having them risk coming in. But we couldn't treat everyone virtually. Children were falling behind in their vital vaccines. To prevent measles, meningitis, polio, diabetics needed care. Ulcers on their feet needed debriding to fend off amputations. Their eyes needed examinations to prevent blindness. Pregnant women needed attending. Appendicitis needed diagnosing. Depression needed therapy. By April, we had erected medical clinics in field tents outdoors on our property, with help from Global Medic. Outdoor natural ventilation is 80 times safer than breathing indoor room air. Our first tent patient arrived on April 22nd, a young new Canadian mother-to-be, 4 months pregnant, without any care. More came. Our community arrived to lend us a hand. Our Chinese business community donated face masks, gloves, face shields. Contractors arrived to build clean floors for the medical tents. We are now open to anyone in the GTA who needs care and can't find it. Kids are receiving vaccinations again, getting ready for school. Diabetics are receiving care. Temporary migrant workers with injuries are being treated. When schools closed, vital nutrition programs for the poorest children ended. We started the COVID Kids Fund to help continue nutritious breakfasts. We are installing medical dental grade air purifiers in every room to be ready to safely deliver care indoors in the fall. The Urban Dental Clinic is now back in operation, treating working poor Canadians in pain, unable to pay a dentist to relieve their symptoms. We did not do any of this alone. We are using your donations to achieve these results. 95 cents on every donated dollar goes directly to patient care. COVID-19 has reduced donations to charities. Even small monthly donations, when multiplied together, can make a huge difference to others needing a helping hand, especially to small charities like ours, tackling big problems. So, thank you. It is our hope that getting back to normal doesn't mean going back to our past healthcare systems. The new emphasis on cooperation and organization is already delivering positive results. Wishing everyone good health, wellness, and safety. Thanking you all for supporting our vision and work for health equity for all in our communities and for a stronger Canada. Thank you.